There are a lot of treatments to treat heart disease. Like in 70s, there was bypass surgery, was a talk of the town. Then 80s balloon, then 90s stent, and now in this century, EECP, FDA approved treatment all over the world. But in spite of FDA approval, there are mushrooms of centers open to earn money. Non medical persons are going to run different uh, general physicians, like those who treat whole body symptoms, those who has not done particularly training in EECP or cardiology are going to run the centers. That is a different thing. Everybody has its own perspective. But a lot of Chinese machines has come in India, and that is lower cost machines. So some unknowledgeable or some highly money oriented people give EECP in a less charges. But after all, patient is suffering because EECP should be taken by trained, just like in bypass surgery. You search trained bypass surgeon who has good hand. In angioplasty, you search good operator that do angioplasty and put stent. कोई भी नहीं कर सकता है. तो ईसीपी में भी ऐसा है कि आप कौन से टाइम पे इन्फ्लेशन पैर से देते हो ईसीजी में और कौन से टाइम पे इन्फ्लेशन को रिलीज करते हो, क्योंकि ईसीपी ये कोई इन्वेसिव प्रोसेस तो है नहीं. मंडे टू फ्राइडे एफडीए गाइडलाइंस के हिसाब से आपको ये 1 कलाक आना है. ईसीपी टेबल आता है मशीन का, उस पर आपको सो जाना है. टेक्नीशियन पैर के 3 भाग, काफ मसल, मिडल थाई और ग्लूटियल रीजन में स्पेशल न्यूमेटिक कफ लगाते हैं. देन दे अप्लाई चेस्ट लीड्स ऑन 3 parts of the chest and apply sphygmomanometer like plethysmograph on the finger of the hand. So EECP computer console and patient's heart are indirectly reciprocate. Now matter start. When you start the ECP machine, at which point you have to give inflation and at which point you have to release the inflammation of the cups, pneumatic cups. That is most important. Nowadays, lot of doctors are going to give franchises. Lot of doctors are going to give social media. Some doctors are newly comes 2 or 3 years, but when patient comes for inquiry, they write down reviews of their clinic and make thousands of clinic reviews of their clinic and appreciation. But basically, the concept, if you understand that reviews are always paid, most probably paid, and unauthenticated, and people just go by reviews and take treatment. Reviews should be authenticated by personal visit to doctor, take numbers of the patient treated, and then you can take the treatment. ECP works as a IABP, non-surgical IABP used in bypass surgery. So ECP works as a second heart. And when you give inflation, when heart is in relaxation, coronary arteries are open, then diastolic augmentation increase, coronary perfusion increase, myocardial perfusion increase, and heart is contracting after load is going to reduction. This is the beauty of EECP. Uh, Congestive heart failure patients, there are special protocol that does not augment venous return. Normally EECP augment venous return also, and cardiac output increase occur also, cardiac index rise also. But in congestive patients, you have to monitor patients carefully when you give inflation, when you end inflation of the from the cuff. EECP has two effects, cardiac and peripheral effects. Cardiac effects, first is it reduces afterload, so reduce load on the heart. Secondly, due to shear stress of blood by aortic root, it open the dormant collateral vessels, and by shear stress it secretes nitrous oxide and decrease endothelin, bad hormone, and decrease inflammatory marker, and it increase nitrous oxide, improve endothelial function, and dilate the diseased vessels also. And the beauty is that during continuous 1 hour process of EECP, there is a secretion of vascular growth factor. There are different types of vascular growth factor, that is hepatocyte-rich growth factor, platelet-rich growth factor, fibroblast growth factor, that create new tubes, new vessels, and that detour the block artery surrounding एक नया नेटवर्क तैयार कर देते हैं, and that is supplying the whole myocardium of the heart. So the beauty of EECP is that it increase myocardial supply and reduce myocardial oxygen demand, and that's why pumping increase. But it should be taken by trained hand. Like in bypass, you prefer trained hand to go for bypass surgery. In stand, you prefer trained hand to go for stanting. बाकी स्टेंट और बाईपास वाले तो हजारों डॉक्टर्स हैं, ऐसे EECP में है। नॉन सर्जिकल लोग डॉक्टर हायर करके EECP सेंटर चलाते हैं। कई लोग अपने आप को रिव्यूज़ इतना ज़्यादा लिखवा देते हैं, पेड रिव्यूज़, और अपने आप को ऑथेंटिक मानते हैं। लेकिन ऑथेंटिसिटी ग्राउंड लेवल से आती है, काम से आती है, एक्सपीरियंस से आती है। तो EECP में हम लोग हार्ट फेलियर का स्पेशल काम करते हैं, जिसका पंपिंग कम है। हमारे पास 7 साल पहले एक पेशेंट आए थे, 15% पंपिंग। ही वॉज एडवाइज्ड बाय वन ऑफ द लीडिंग हॉस्पिटल एट साइंस सिटी to go for heart transplant and give 30 lakhs rupees. His guru denied and sent to me, and I give EECP before 7 years, and his pumping improved to 48%, 15 to 48, 50%. Nowadays he is doing farming. ऐसे कई पेशेंट आते हैं, 25% वाले, 30% वाले, 20% वाले, कई पेशेंट्स आते हैं। कई पेशेंट्स पल्मोनरी हाइपरटेंशन वाले आते हैं, उसके प्रोटोकॉल्स अलग होते हैं। कई पेशेंट राइट वेंट्रिकुलर स्ट्रेन पैटर्न वाले आते हैं, कई पेशेंट एरिथमिया वाले आते हैं। तो उसको मैनेज करके, दवाइयाँ से मैनेज करके EECP देना पड़ता है। अदरवाइज व्हेन यू गो फॉर सर्जिकल इंटरवेंशन, then anytime ischemic reperfusion injury occurs, and it can lead to stroke or arrhythmia, or if you are diabetic, then future infective complications, and sometime sudden cardiac death occurs if you have genetic defects. So any revascularization process just relieve symptoms and improve the pumping. particularly EECP. Nowadays, a lot of one company that is not FDA approved introduced ESMR, that is acoustic laser, that is localized revascular angiogenesis. It is not going to open the blocks. Localized blood supply बढ़ाती है. That is not FDA approved. It is under investigational use. It has a lot of complications of laser. But people don't understand. I prefer intensive medical treatment as per clinical trial by Cleveland Clinic. Dr. Nissan has said that give intensive medical treatment. Take plant-based vegetarian alkaline diet. Avoid alcohol, avoid tobacco in any form. Avoid cold drinks, that is liquid death. One American surgeon has said that it is a liquid death. Avoid sugary drinks. Avoid saturated fat items like ice cream, lassi, sodas can be avoided. Avoided packing items. Avoid real fruit juice that is full of sugar, carbohydrate, full of empty energy. So, bakery products you should avoid. You should avoid pickles, papads. That irritates your GI tract and vascular system. Non-vegetarian should avoid fried meat. And avoid sedentary lifestyle. Don't be a couch potato. And be relaxed. Take 7 hours sleep. If you have no sleep, go for pranayam or meditation. Otherwise, take sleep medicine. Sleep medicine is not a stigma. Mind is a part of body. When you want 2 times food, body's brain wants also relaxation. If you want to clear your blockage, your mind should be clear. Because if you keep the burden of that there is a blockage in the heart, there is a blockage in the heart, so blockage will never clear. When you clear your mind that your blockage has been gone, then blockage has been gone along with all the medical treatment, EECP treatment, diet, walking habits, aerobics, cardiopulmonary rehab program. So EECP treats heart failure, intractable angina, do natural bypass, treats diabetes, treats renal failure, treats ischemic stroke. People go for physiotherapy after a stroke. Spend lakhs of rupees, but no result. When you have ischemic stroke, it is a study that take EECP treatment, you might get improved cognitive function or motor power of the limbs. So EECP is multifactorial effect. It has effect on Alzheimer's disease, Parkinson disease, low vitality in a man. It improves vitality. It reduces the obesity. It reduces the cardiometabolic syndrome. It reduces the cardiac hypertrophy. It reduces the hypertension. But it should be given by proper hand, when to give inflation and when to leave inflation, and at which protocol you have to manage the patient is very much important. We at Heart and Vascular Care Advanced EECP Center, Ahmedabad, running 2 centers, one at Science City, Sola, and one at Prahlad Nagar, Makarba branch. So you can take benefit of EECP and get rid of surgery and stenting whole life. Thank you very much.